Hi, everyone. Thank you for joining our webinar today. We're really excited to have you all here to talk about patient confidentiality and our PHI redaction tool at Ottimate. The webinar is going to begin shortly. We're just letting people enter into the webinar from the waiting room. So just give us a second and then we'll be ready to go. Okay, I think we can get started. So I'm very excited today to welcome Jono Bowles and Taylor Brammer, both members of our Automate healthcare team. And they will be discussing a super important topic from reactive accounting to safeguarding patient confidentiality. Just a couple housekeeping notes before we begin. If you have any questions, please pop them in the Q&A functionality at the bottom of your screen. Also, we have everyone muted, so no worries there. If you have any questions, just pop them in the chat and we will get them. And we are recording this session, so you will receive the recording after the fact. So no need to take notes. You will get the recording afterwards. So now I'm going to pass it off to the team to get started.
Awesome. Well, I'll kick us off. Hello, everybody. Thanks for joining us today. Excited to be here. My name is Taylor Brammer, and I'm a senior partner manager here at Ottimate, and I focus specifically on our healthcare vertical. So I've been in the healthcare space for, we'll just say over 15 years instead of the exact number. But for Ottimate, what does healthcare mean? It ultimately kind of falls into a few categories. So specialty care, DSOs or dental service organizations, and then long-term post-acute or senior living. So I help partners and I help clients kind of streamline their financial operations through Ottimate, and I also help our partners with that process as well. So I'm excited to be here and look forward to the webinar here.
Thanks, Taylor. Hello, everybody. Great to have you here. I'm Jono Bowles. I lead our healthcare industry product function here at Ottimate. I too just crossed over the 15-year threshold, which is shocking to me, but I started my career in AP automation consulting in hospitals. So I was doing the traveling every week lifestyle and implementing software solutions. And now my role at Ottimate is to help understand the unique challenges that healthcare organizations face in AP and finance and make sure that we're building solutions that actually meet those needs to help our customers scale up and topic of today, help protect patient data as well.
Yeah, so that's the goal today is, to ultimately educate and build awareness around how PHI or patient health information may end up on invoices and kind of speak to what we see in the market, what we've witnessed, and then kind of specifically how that applies to HIPAA compliance and ultimately PHI redaction and some of the risks that are associated with that falling into the back office. So the plan is to talk a little bit about that, speak to some real examples, some best cases, and then we do want to highlight some tools from Ottimate that ultimately we think can help.
We will certainly have time at the end for Q&A as well, so feel free to drop any questions you have into the Q&A function, which I believe is active or will be by the end. Before we get further into things, just a brief disclaimer. You've probably seen these before, but we're providing this session just for informational purposes. Please do not treat us as legal experts, nor this as legal advice. You should certainly consult your own internal compliance officers or legal counsel for specific guidance around compliance in your organization. And with that out of the way, we can get started. So at the top here, let's just set the stage for what you all might be facing currently with some quick data on where the industry is at today. So this figure comes from a recent study published in the Journal of the American Medical Association. Yeah, administrative complexity accounts for at least $265 billion in waste annually in the U.S. healthcare system. Absolutely staggering. The belief is that this waste stems from things like increasingly complex billing procedures, managing different health insurance plans, again, things that you're all familiar with, fortunately and unfortunately, and just, other inefficiencies that help drive up those costs, ultimately without achieving the ultimate goal of improving patient care. Comprising that staggering figure, there's a few trends, and the things that I've picked out, just kind of three. These can kind of be summarized into three. Manual inefficiencies. So 85% of healthcare organizations still rely on paper-based old school manual AP processes. We feel that it costs about $6 to process a single invoice manually compared to just $1.45 with automation. So there's a lot of savings to be had. Shockingly, in 2025, 91% of invoices are still paid by a paper check, believe it or not. Second kind of categorization, workforce and fraud pressures throughout. The number of accountants and accounting graduates entering the workforce has declined by 33% in the last 10 years. It feels like everybody I knew was doing that, and now it's declining. So, yeah, even as demand is expected to grow, there's fewer folks entering the job market that experience. At the same time, healthcare organizations are losing an average of 5% of their revenue to fraud, and occupational fraud jumped 90% during COVID. The last of the three, patient and payment risks. So breaches, like one at a major dental group recently, resulted in a $4.4 million settlement. Things like that highlight the reputational risk that can occur when PHI isn't safeguarded. Talk about PHI a little bit more in a minute. So Ottimate. So how do we support healthcare? At Ottimate, we really aim to do our part to improve upon some of these inefficiencies. We focus on the entire invoice to payments lifecycle and how we can use our mature and proprietary AI to improve your existing workflows and create new ones if needed with AP automation. We've been building our own AI tailored to the AP process for over a decade, well before the recent AI boom that we're all very familiar with. Historically, we found that healthcare has lagged behind other industries in automating these types of processes, but we're also finding that it's starting to change. What we feel sets us apart is that we don't rely on legacy OCR. So always throughout my career, I like to call it the scan and hope it reads it correctly approach. Rather, our AI is built for accuracy and efficiency from the ground up from day one, which is, of course, especially important in healthcare where a little mistake can have a big consequence. So not only does automating AP help create efficiencies, but again, $6 to $1.45 in the cost area can also increase your profitability. With simple and scalable AP automation, we feel it's pivotally important that our customers can easily expand their solutions too to fit expanding business and make it easy to proactively do your part to help prevent fraud and data exposures. And so that ties us directly into today's focus, PHI and how it ties into HIPAA compliance. So concerns around PHI and HIPAA adherence are a constant in the patient care world. Don't need to tell you that, but the back office can pose challenges too. And not only can it be problematic for patients and having private information get into the wrong hands, but it also creates a risk for providers and the operators. And that's why we have made this a major area of focus for us. So let's talk PHI. I know it's lunchtime, so I'll try to keep this very as exciting as I can on PHI, but let's talk about PHI and where it can show up. And again, this is probably a review, but I hope that we can offer maybe some ideas of ways to continue to help protect PHI in your environments. Let's talk about what it is. So PHI in protected health information, any data that can be tied back to a patient. So we think a lot like names, date of birth, procedure codes, but even something like a room number can be PHI when it's tied to an identifiable patient record. People think about PHI and exposure, they usually think about EMR systems or a patient chart. And sure, that's a super common place to find it. But in finance and AP, we see PHI pop up in unexpected places. So just some examples that I jotted down. I've been talking to customers recently. So these are real. A dental practice maybe gets an invoice from a lab, or if someone's had a crown made or a retainer made, and the invoice includes the patient's name as part of the billing procedure. again, between the lab and back to the dentist. Another example, like imagine a senior living facility operator getting an invoice from an outside OT or PT provider for services provided to a resident. The invoice would list the resident's name, therapy details, and then sometimes even the diagnosis code that led them to be there. And then lastly, just a medical device. So a patient receives a medical device from their physician's office, custom made for them. Custom device manufacturer might invoice the clinician, and you can see where this is going, but including the patient name and their diagnosis on the paperwork as well. So they're real invoices, real finance teams handle every day. And again, over the past few years, we've noticed an uptick in these types of invoices. I believe it to be due to the fact that we have an increasingly decentralized world of healthcare. So related to PHI, we think a lot about HIPAA compliance, and when we think about HIPAA compliance, we're a technology company, but it's not just about technology. It's about daily habits. And we feel like this is, just as important. Even small lapses in kind of what's going on at a daily basis can expose PHI. And these may be reminders, but I hope that, maybe there's something new to you here that is a, lesson learned or something you can slightly improve upon to improve that patient data safety. So locking computers sounds simple, but even when you're working from home, one of the most common risks we see is just unattended screens. Uh, Always lock your workstation before you step away, even if you're at home. Just one single habit can help prevent unauthorized access. MFA, a lot of systems are offering MFA these days. Use it. Passwords alone are not enough anymore, unfortunately. So MFA will just help ensure that even if you have a password compromise, there's an extra layer of security that you can be protected with. I guess a brief step into technology, but HIPAA compliant tools. So it's really tempting to just email or share a document, especially something that seems kind of innocent like an invoice. But not every system is secure. Make sure that you're using HIPAA compliant platforms like Ottimate for transmitting and storing files when you do. That applies to finance and back office just as much as the clinicians and patient-facing folks. Never leave sensitive material unattended. So, and probably heard this one before, but again, include things like invoices when you're thinking about leaving stuff out. That can be just as risky as leaving a patient chart open in the hallway. Finally, if something does happen, PHI gets shared accidentally, make sure you report it as fast as you can. A quick response can oftentimes make a big difference in the outcome, both for you and then the patients, and taking something that could be treated as a minor issue and preventing, a full-scale breach ultimately. Compliance is everybody's responsibility, us, yours, and beyond. So by following just simple practices, I think that we can all help protect patients, organizations, and ourselves. Taylor, I know you see a lot of this, out in the field. I'll leap you in here, and if you have anything to go through.
Yeah, I think, it's important to understand kind of the risks associated with, with PHI getting out there. I think, one of the biggest risks that we see, I guess the most common risk that we see is, it's primarily unintentionally released, through invoices is what we're seeing, in our line of business, but it can be statements, it can be correspondence, and PHI, it can be super easy to miss, and sometimes it can be hard to define. And I think that, I know that we have resources and healthcare organizations have resources to help define that. But historically, the kind of mid-market healthcare, which is where we focus, hasn't really been supplied with the right tools to manage this, outside of the EMR or out, beyond the clinical side. So, what about invoices? What do we do for the back office? How do we incorporate the strategy to the entire enterprise, right? Like we can't leave the back office exposed. So, I think that the first step is kind of recognizing that this is not just a front office issue, and that takes a lot. It takes a big step. I think for years, back office teams or finance teams were either unaware or they may be in the situation where they kind of turn a blind eye to this being an issue for them. But I know for a fact that, regulators and patients are definitely not turning a blind eye. In fact, I think that, the rules and the regulations and the monitoring are really, getting more strict and more real. So, what are those risks? What are the threats? HIPAA violations can ultimately lead to significant fines, which the mid-market simply can't afford. I don't think anybody can afford it, but the mid-market is especially vulnerable to this space. And a violation or a PHI release unintentionally, whether it gets into a bad actor's hands or, whether, if it's even caught by the patient, that can be more damaging because it undermines the patient trust and it puts that healthcare organization's reputation in jeopardy. And then, ultimately what legal exposure is there. And when I talk to healthcare leaders about PHI, they're not really expecting me to bring that up when I'm talking about, AP invoice automation. They always assume that I'm talking about the front office or I'm talking about rev cycle management because those, definitively tie to the patient record. But when I tell them that it's showing up in invoices and we're seeing this and we've been in this industry for, for years and we see a lot of invoices, a light bulb, kind of goes off, and it goes off for a couple reasons. And the first is obviously the unintentional exposure of PHI. They know that carries some criticality to it, and there's risk there, like we talked about. But the other side of this is, any benefit of existing, back office AP automation kind of gets broken because without a solution to help them search for the PHI or identify it, or even ultimately redacted, their teams are relegated to a manual process again. So they have to manually search for PHI through their invoices, right? They tend to print these documents off. It's paper-based, it's physical. How do you encompass that when you have, multiple locations and multiple teams? How do you standardize that process? And then how does that information get back into a controlled workflow, a streamlined workflow? And then finally, what do we do about storage and what do we do about access? These are questions that the back office should be prepared to answer and should be handling. And it's a compounding problem, but it's something that needs to be addressed further and something that we're trying to help with for sure.
Yeah, I think that we have a lot of options of what we can do more so now in the modern world than we used to. And the reality is many organizations are just short-staffed, right? Like redacting
For sure.
PHI or handling PHI with, the old school Sharpie method or basic software is, it's been there, but it's slow and error prone and introduced risks of its own. So excited to talk a little bit about what we've done with our recent release. So we launched the first AP specific PHI redaction tool at Ottimate. We saw the finance teams needed a solution designed for their workflows and not just a clinical overlay. So it's an AI-powered approach, and it automatically identifies and permanently redacts PHI from invoices. Again, things that we talked about, like the patient name, date of birth, social, and so on. And then even some of those more difficult to identify things that, aren't as clear in a, social security number data format, and so on, to just help organizations do their best to stay HIPAA compliant without adding more of that manual work. We feel like this is a big step forward compared to the traditional methods. And throughout a lot of my career, I worked with those traditional methods, and I'm really excited to have been a part of this. This is like pretty groundbreaking in terms of time savings again, and then ultimately protecting that data. With the older tools, people were forced to rely on human judgment and manual correction, and now one of the joys of AI, I can handle it at scale, and it creates just a safer environment overall to for the patients and the providers. With our tool, though, we found it important. Humans always get the final say. So, just early testing, talking to folks, there's some fear of like, we redacted something that's necessary to be able to pay the invoice. Again, humans will always get the final say before the redaction is committed, but there is this intelligent layer suggesting what should be redacted. But that manual review step can kind of help ensure that each individual situation gets the care that it needs. I think it's worth emphasizing too, it isn't just about compliance. It's about some peace of mind, and hopefully we give some of that. Finance teams can process invoices more confidently with this, I think, knowing that they're protecting sensitive information and just kind of have that extra set of eyes, so to speak, reducing the risk, hopefully, of costly breaches.
Yeah, and I think that PHI redaction is just it's kind of a piece of the bigger puzzle. Our broader story here, and I think the broader story in general is how AI can kind of transform the back office, how we can leverage AI to become more efficient, leverage the data that we're getting, use it efficiently, and that definitely applies to PHI detection and redaction, but also to the entire invoice process, invoice process automation. I know that at Ottimate we're definitely leveraging AI, specifically for faster invoice processing with greater accuracy. We use it to customize our workflows and create more efficiency within the approval process. We're leveraging our proprietary AI specifically for that fraud protection piece that you talked about. We know that in healthcare and across the industries, very large players are struggling with fraud, and they're struggling with you know invoices from bad actors that they ultimately receive and have to fight against. We're using our AI to identify those invoices and really kind of place a trust score on invoices and correspondence that we can then send to somebody to ultimately review and decide whether it's worthy paying of. And then obviously within the invoice processing automation, beyond reducing the costs of internal costs, we also want to reduce external audit risks and costs, and then ultimately protect the profitability of the organization. So specifically, I know that we talked about we were going to say that we have some specific use cases through our customers. So one of our clients, West Harbor Healthcare, which is an assisted living community, was able to reduce their invoice processing time from 15 to 20 hours a week to about half an hour every morning, just by leveraging the efficiencies that you can gain through AP invoice automation and our AI tools. So it really helps them to focus on not only the business aspect, but also providing ultimately better patient care, which is what they're all there for in the first place. So, our PHI redaction tool, it's not necessarily a standalone tool. It's really part of kind of a larger AP strategy, a larger strategy that we're trying to specifically help healthcare organizations with. And I think by modernizing the workflow and leveraging AI, the scale will be there, the scalability, the trust will be there, and ultimately we can contribute not only to the back office, but this enterprise view that I'm talking about, where we're really trying to work from the front to the back and deliver a solution that accommodates needs across the organization.
Thanks, Taylor. So I think with that, we can wrap up. Just a few points for you to take away. Hopefully these are take away anything from this, 4 things. So, first, PHI exists beyond the EHR, EMR. We find, again, that it shows up in invoices and back office documents, so finance teams need to be vigilant about it. Second, efficiency protects your bottom line. So automating AP and adjacent processes will reduce costs, limit fraud, and ease staffing pressures. Third, safeguarding PHI. So that means safeguarding both your patients and your reputation. A breach doesn't just cost money, it erodes trust and confidence. And finally, as I said, compliance is everybody's responsibility. Something I say internally at Automate and every chance I get, but whether you're in a patient-facing role or in the back office, we all play our part in protecting patients' sensitive information. And with that, we can head into the Q&A. So I see we have a couple of questions. So first up, feel free to add more if you have them. But first up, will there about PHI redaction, will there ever be a way to remove the redaction after saving? Is the data still embedded within the overall file data to be picked out later on? So in regards to our PHI redaction tool, the answer is no. So there is that once the redaction is committed, there's kind of a two-stage process. We propose the redaction, and then once someone from your team confirms that yes, indeed, they want to redact that information, it becomes permanent at that point. So it's a true redaction designed to eliminate the data permanently. Now, again, we introduced that manual review process or review step at the end precisely for that, just to make sure that it is indeed something that you want to redact. And yeah, we feel that that helps balance that automation, but then also kind of the comfort level as folks learn to trust the AI and the suggestions that it makes. But great question. Let's see. Another question. So what happens if the system doesn't automatically redact the PHI information? Okay, so first up, the invoices are still stored in a secure manner, just to level set that. But as an added step, so for invoices that get uploaded to a location that you've tagged as possible PHI sensitive, we still have that kind of final check, so that you can have the final say on what gets redacted beyond the proposals. Another one, when might we be able to see a demo of the actual redaction process? So we will have this here in a second at the end, but we can facilitate that now. So our PHI redaction product is in beta right now. So we have a beta sign up form that you can sign up with that QR code and get more information, see a demo, all that good stuff. And yep, it's on the screen now. So feel free to scan that QR code.
Also, just to note, in our follow-up, we will share the link to this landing page where you can sign up for the beta as well.
Awesome. Thanks, Emily.
Yeah.
Last question that I see, at least. What kind of information does PHI redaction redact? Great question. So the AI is trained to redact or identify the 18 core PHI identifiers. Obviously, some of the PHI values are more vague than others, but we found that the AI does an excellent job at the detection. As we do with all of our AI, the core invoice processing AI, and now this, we're able to kind of continuously evaluate, fine tune it, and make it better. So this is something we can, do ongoing as we get feedback. Excited how iterative we can make it. Honestly, that it's as technology, as AI improves, expectations improve and grow. We can kind of grow alongside that.
Well, thank you everyone for joining. As mentioned, we will share the recording once we have it available by email. But just want to thank Taylor and Jono for joining us today. You guys were amazing, and thanks for walking us through all this. And we appreciate all of you for joining. So have a good rest of your day and look out for our recording.